And as always, we're just going to start off with using our hip flexors, stretching our hip flexors, and then using them through range of motion, because guess what? Most of us sit all day now. Not that that's a big change from, hi Pat, oh, hey Patty Fox is in the house. Better watch out. So most of us are sitting at our computers, on our couches, in the car when we're working, all this stuff. And so we really sit like all day. And when you leave a muscle in a shortened position, like if I left my bicep like this all day, it would take that opportunity to just shorten and shorten and shorten, because our muscles have elastic qualities to them. So they just want to be short, and that'll be its natural position. It's shortened. We call it adaptive shortening. And so when I'm sitting all day, my hip flexors in the front of my hip, from my femur all the way into my low back, will actually adaptively short. And so we have to, or we want them to be shortened when we're contracting, when we're using them, not when we're just passively just sitting. We want them to be short when we use them, not when we're just, really passive. And so we're going to tell them when to turn off or turn on by contracting them, and then we're going to tell them when to turn off by lengthening them. And to do this, we're going to do some dying bugs. We're going to do two variations of this. One is going to be ipsilateral, so we're going to be moving the same arm and leg, and then we're going to do contralateral, where we move our opposite arm and leg. And we're going to go for about 45 seconds of each. It's going to get our blood pumping, our tissues warm. It's a pretty safe move to do if you're having a little bit of low back pain. There shouldn't be much movement in your low back, so it should feel pretty good. And then we're going to move on to some hip flexor stretching and using our hips. So this is week 6 of low back pain exercises. My name is Dr. Mike Scott of Kinetic Potential Physical Therapy. And we're going to get going here. We've got some low back stuff. And like I said, it's going to be a little bit more of a workout. If anything is bothering you while we do it, take a break, just hang out, work on your breathing, relax, think happy thoughts. We're going to be moving on to something else within the next minute or two, regardless of what we're doing. So you're not going to miss out on much. Just clear my screen here. And so we're not treating any diagnoses or anything, but maybe you have a stiff, achy back, and this stuff is going to wake your trunk up. We're going to stretch out your hips. You're going to be feeling really good after this. Should be about 40 minutes, maybe 30 to 40 minutes today. So I'm going to pop back to my mat. It's the only thing you're going to need, just a mat and maybe a pillow if your neck is a little uncomfortable. So let's pop back there. And the first thing, like I said, the first thing we're going to do are dead bugs or dying bugs. We're going to do ipsilateral, so one side of our body, and then contralateral, opposite side of our body. And so you're down on your mat. You've got your legs up. We've got our knees over our hips, our hands over our shoulders. And we're going to press one side together, and that's going to activate the anterior portion of the trunk and the hip flexor on that side. And the opposite legs and arm are moving. And we're going to do 10 on one side, 10 on the other, and then we're going to go to contralateral. 4, 5, always pushing these guys into each other, telling those hip flexors that they need to shorten versus just letting them shorten when we sit. And I think I got one more left, and then we're switching. And already it's like, oh man, my anterior trunk is lighting up, my core is firing. You should be able to breathe while you're doing this. Should be able to keep your ribs down. You shouldn't have that big rib flare we've talked about so many times. I think I got 3 more. We're building up the resiliency of our trunk so we can withstand the activities of daily living that we're doing. And sitting and all that stuff. We need to have strong trunks to do nothing, surprisingly. So now we're up in the air. We've got, once again, hands above shoulders, knees are above your hips, your feet are out. I'm going to reach my right arm back and my left arm out. And then back to where we start. And then I'm going to switch. And we're going to do 10 on each side, so 20 total. And I'm not trying to flatten my back, but I'm trying to prevent movement in my spine. So when my leg goes out, I want to just prevent that arching of my back. But I don't have to flatten my back against the floor, because some people don't like doing that. It causes them a little bit of discomfort in their back if they have a flexion intolerant back. So we just want to create bracing, a strong, nice trunk. Dying bugs are a great exercise, an introductory exercise if you've been having severe low back pain, because they don't create a lot of movement in your trunk, but they really fire up the anterior portions of your body. I think that was 10, somewhere around there. And you can move just your arms to start, or you can move just your legs to start. It's a great way to just kind of ease back into movement, some core specific exercising if you've been suffering from low back pain. So we told our hip flexors when to turn on, we told them when to turn off. It's like a mantra. We know what comes next. We're just going to do a hip flexor stretch, front of the hip stretch. We're going to lengthen out all that tissue that we've shortened all day from sitting and typing, and you know, maybe you do have a commute still and you're still sitting in your car, although it's probably a shorter commute. I know that my drive up here to the clinic takes about 20 minutes, where typically it takes about an hour. So LA traffic is significantly better. We're going to tuck our toes under in the back because we want to make sure that we have big toe mobility. That's a whole nother story. Tune in on Fridays where we go over hips and knees and you'll know why that's important. You're going to bend forward a little bit, posterior tilt your pelvis, and come on up. And here you are. You're going to be here for 1 minute. We're just hanging out. You're feeling a big stretch in the front of your hip. And if you're not, go ahead and grab that foot and just make sure you have a nice vertical torso. You're not leaning back, compressing your spine. If you have to reach your foot, just pop it back down, reset, and come up. I'm squeezing my butt cheek to help push my hip forward and open up a little bit more in the front. We're utilizing this thing called reciprocal inhibition to stretch more in our hip flexor. If I squeeze my butt, if I activate that muscle, my brain and my spinal cord tell my hip flexors to relax. We're actively telling them to relax by squeezing your butt. Instead of passively telling them to shorten, we're actively telling them to lengthen. And we've got 8 seconds left. I actually used my watch for once in one of these virtual clinics. And then we just easily switch. We get all our parts to 90. Our toes are tucked in back. You tuck your butt. You come on up. And I'm going to grab my heel on this one or grab my ankle on this one. And we're just going for 1 minute. Breathing nice, easy, gentle breaths. On Friday, I talked a lot about relaxation breathing, something called 4-7-8 breathing, and how that can help calm our nervous system. And if we do that when we stretch, we focus on our inhale, we hold, we exhale for a long period of time, we will get more relaxation in our central nervous system. We'll be able to access greater ranges of motion in our joints because our muscles will be more relaxed and can stretch better. And so working on your stretching and your breath work at the same time is a great pairing. You can just kind of knock 2 birds out with 1 stone there and get a huge benefit. It's almost like the sum is greater than the parts with that one. If you're breathing and you're stretching at the same time. Same thing with mobility work too. All right, we got about 5 seconds left here. Okay. Typically, after we do this series of using or telling our hip flexors to turn on and turn off, and then stretching out our hip flexors, I like to have people do split squats because it lengthens the quads, works on trunk control, balance, all that stuff. But I want to keep things a little varied here, so we're going to be doing some bridging with a knee extension. We're going to be doing some bridging a little bit later on for our hamstrings specifically, but this bridging is going to be for our glutes, opening up the front of our hips and working on a little bit of trunk control. So stability exercises mixed in with actively stretching out your quads and your hip flexors. So we're going to bridge with a leg extension at the top. And you're going to do 1 leg extension per side and then go down. We're going to be making 10 repetitions of this. I'm going to show you a couple things. I'm going to show you how it should be done. I'm going to show you one of how it shouldn't be done, and then we'll get going with 10 more. So if you look at my hips as I go up, and when you're doing it, I want your head down, but just so I can see the camera here. When your hips go up, you're going to kick, and you're going to kick, and there's not going to be any movement in your hips. You're not gonna have any wobble. It's like if you had a carpenter's level, one of those bubble levels across your hips, that bubble's gonna stay right in the middle. You don't want one hip to drop and one hip to go up, okay? So I showed you a good one. Then a bad one would be if I go up and lift and my hip sinks down. That's bad. That means that we're not strong enough, we don't have enough control on our glute to prevent rotation. And so if that's the case, I'm just going to have you do 20 regular bridges, just up and down with your hips, both feet on the ground. You don't lift any feet, but you do 20 reps. For the rest of us, if you do have good control of your pelvis, we're going up. We're going to start now. Going up. Kick. Kick. down and reset. So we got 9 more to go. No movement in your hips. We're working on the oblique control structure, so our glutes, our obliques, and our lats in our body to prevent that rotation. You can have your arms out, you can have your arms up to make it a little harder. That's all good. We're focusing on squeezing our butt cheeks. We're getting all that opening in the front of the head. We're reinforcing all that range of motion we got from stretching out our hip flexors. I think I got 1 more, maybe 2. I'll do 2 more. Squeezing those butt cheeks. And down. All right, so we've worked our hip flexors, we've stretched them. Now we're going to start going through a little bit more range of motion of our spine mixed with a little bit of control. So typically when we do cats and camels, it's looked at as just like an overall mobility exercise for the entire spine. It's kind of passive, but we're going to do lumbar or low back specific cats and camels. And to do that, we're actually going to bear our weight on our forearms and our knees. It's going to put us in a position where the only thing that can really move is our low back. Yes, the rest of your spine will move a little bit, but the main focus is going to be on your lumbar spine. And we're going to want to do it with control. We want to be able to get into an anterior pelvic position and a posterior pelvic position, but with control. We don't want it to be like the passive place where we go running. Last week, I think I was working out in my garage one day, and I think somewhere like 10 to 15 people probably ran by, and half of them had that anterior pelvic position, which tells me that the muscles in their low back are tight, but also the muscles in the front of their hips are very tight. They don't have ownership of their pelvis, or they should be running in a neutral position because it's a lot more powerful and a lot more efficient to run. It tells me that they're running inefficiently, but they have to because their passive structures, or their structures of their hips and their back are tight. So we want to own these things. We don't want to, be the slave of these positions. We want to be able to get into and out of these positions when we want to and when we need to. And a lot of times, if we're creating efficient, powerful, and athletic movements, we don't need to be in those positions. We need to be very neutral. So what we're going to do is we're going to pop down, forearms down, knees on the ground. You can tuck your toes, you can point your toes. I'm not too concerned about it with this one. And you're going to tuck and tuck. And so we're flexing our low back and we're extending our low back. We need ownership of this, so we're not just flying around, we're not twerking here. We're just flexing and extending. Although I bet there's some people out there going to make some twerking jokes. And we're just going up and down. We're moving our pelvis on our femurs, on our leg bones, and we're creating lumbar flexion and extension. So we're also working on our hip mobility here. And I think I got 2 more in each direction. And I actually feel when I posterior pelvic tilt, my abs, my obliques fire almost, I can make them almost cramp if I fire hard enough. And here I make my low back muscles work. Those are both things that we want to work on, especially the low back extensors. This is going to come up again in a couple minutes here. But now, all we're going to be doing are 10 cobras. So we kind of started with control, so some motor control, some relearning those movements of flexion and extension of the lumbar spine, versus passively just flexing the spine all day. And now we're going to feed it a little bit more extension with just 10 regular cobras. So we're down here on our belly, putting our hands underneath our shoulders, and you're just going to push up nice and high as you can go. Maybe yours only goes up here, maybe down here based on your limitations, and that's cool. You just go where you can, and that's the beauty of these stretches and mobility exercises, is that you can make them yours. Whatever works best for you. Your stretch doesn't have to look like mine, and mine doesn't have to look like yours. It's whatever's best for your body. And we're doing 10 of these. I think I got 3 more. I'm keeping my shoulders out of my ears, getting a little bit of compression in the low back, and that's okay because we're controlling it. We're actively putting ourselves there. we're actually getting our spines ready with this thoracic mobility and extension to roll. We're going to be doing lower extremity driven rolling. And I think that was 10. And so we're going to be making segmental rolls, meaning that one part of our body is going to move, then the next above it, and then the next above that, and so on and so forth. And so we're going to be driving this with our legs only. Everything else is muted. So we're going to be laying on our backs, fully extended. We're only going to move our leg, and our whole body is going to roll. But to do it, we need to coordinate the deep spinal stabilizing structures, our oblique structures, and our thoracic mobility and our hip mobility. So we're going to be out here fully extended. Maybe if you haven't caught this one before, maybe you want to watch me do a rep. Because we're going to be going from on our back to on our stomach, and then on our stomach to on our back, all with the same leg. So I'm only going to be using my left leg. It's going to reach up towards the ceiling and then over my body. And then the rest of my body is going to follow in a segmented fashion. So I'm up, I'm over, I'm using that mobility in my thoracic spine, and then I fall over. And here I am. Gravity does the work once you get halfway. And now we need to be using our glute strength, that lumbar mobility that we were forcing with the cobras, and some thoracic mobility, which is great for low back health as well. So I'm going to relax my head, I'm going to let my leg do the work, and then I'm going to do 2 more reps while I shut up. So I'm not using my arm. Maybe I won't shut up. So I'm not using my arms, I'm not using anything except that leg. But I'm working on my hip extension, my back extension, all that stuff mentioned before. And last one on this side. Okay. Now I get to do the other side, you get to do the other side. We're just doing 3 per side. I don't think I mentioned that before. So up and over, and maybe you'll see that you can do it on one side, but you can't do it on the other. And that's something we call an asymmetry, and it's definitely going to be something you want to work on. Maybe it's because you don't have the hip extension range of motion, or maybe your thoracic mobility is limited on one side of your body. And that just kind of tells you, like, oh, maybe I should work on these things. 1. I'm not using my arms. There's 2. We got our last one. Using those obliques, abs, pecs, and lats. All that good stuff. Whew. Just to create a roll. All right, I think that was 3. That was 3. Okay. So we passively put ourselves into extension. We use a little bit of extension through our spine with the rolling, and now we're actively going to use it. And a lot of times, people come into my clinic, they have low back pain. I introduce some core exercises, but nothing really specific to the low back area. And then when they start to finally feel better and progress, I say, okay, now we're going to specifically target the muscles of your low back. We want to get them really strong. And it makes people freak out. And now, with every other part of your body, if you come in with weakness and atrophy, what are we going to do? We're going to strengthen them, we're going to use them, and people are like, yeah, cool, I'm going to get my shoulders nice and strong, and my knees and my legs strong, but as soon as it's someone with their low back, and you're like, hey, we need to get your low back stronger, they freak out. But if you look at MRIs of people's low back muscles who have low back pain compared to it's like their standardized subjects in these tests, in these research articles, we see that people with low back pain typically have atrophied muscles of the low back. Their multifidi, their erector spinae, and other muscles that are in their low back are actually weak. Or let's say they're smaller. They're not as big and bulky as the people who have healthy, non-painful backs. And now sometimes there's not a direct correlation between these things, but I like to say, hey, here are people who have some atrophy and they're having pain, and here are people who don't have atrophy and they don't have pain. And so I say, okay, maybe we should get these people's muscles to be stronger and then see what happens. Maybe they need stronger muscles to withstand the forces of the activities they're trying to do. Whether it's picking up your kids, going running, deadlifting, all this stuff. And the basic place that I like to have people start is on their stomach, which we're going to do. And then we're going to create some thoracic extension, which we worked on with our cobras and our rolling. And to do this, we're going to have to use the muscles of our low back, and we're going to hold for 2 seconds, and then we're going to control ourselves down. Now it's not a big, huge range of motion. We're not trying to recreate the cobra. All we're trying to do is get our chest and our head off of the ground. We're gonna hold 2 seconds, and then we're gonna go down for 10 reps. And this can start to pump some blood into those muscles. It can start to use them and start to remodel them where they get some hypertrophy and build up and get bigger and stronger. Okay, that's why we're doing this. We're trying to strengthen the actual muscles of the low back versus just working around with the hips and the thoracic spine and the abs, which is what a lot of people think to do, but they always avoid their low back because they think it's going to make them hurt. And maybe they do these things and they're sore. And maybe you're sore tomorrow and you're like, man, my low back muscles are sore. And you're like, yeah, if you did bicep curls for the first time in a long time, your bicep is going to be sore too. That's the same thing, and that's okay. It's okay to have that. Shooting pain down your legs, severe crippling pain in your spine, those things aren't okay. But that soreness on either side of your spine and the muscles, that stuff's actually okay. So you're going to start on your belly, and if you want to, if you feel like your back muscles might be a little bit weak, you're going to start with your arms down here. But if you feel like they're strong, you can actually put your hands right on the side of your head. You're going to come up and just lift your chest, lift your head, and then go down. You lift up and you hold for 2 seconds, and you should feel the muscles in your low back working. And then go down. And we're doing 10 of these. And if you have shoulder pain or neck pain by putting your arms up here, just put them down by your side. That's okay. They're still gonna, your low back muscles are still gonna work. And I'm trying to do this without squeezing my butt muscles as hard as I can, because I actually want my back muscles to do a lot of the work. I'm breathing while I hold. So I want my muscles to do the work, not my lungs. I have 2 more to go. Last one. And those are just prone extensions. That's just simply working on the muscles of our low back, our paraspinals, our quadratus lumborum. We're going to use a little bit of glute and the multifidi of our lumbar spine to get there. We're going to shift to an isometric exercise for our low back muscles and for our trunk muscles. We're going to hold it 45 seconds. It's going to go after the same muscles that we just worked on, but we're going to use gravity, and we're going to use a held position to create the resistance and the load. And so this is going to be a tall kneeling, we'll call it a tall kneeling back extension isometric. So all we're going to do is you're going to sit up in the kneeling position. You're going to push your hips back. So all of a sudden gravity wants to pull my upper body down, and so to prevent that, the muscles in my low back have to fire. I'm going to keep my neck nice and straight, and once again, if I had to do my back extensions with my arms here, this is where you're going to want to keep your arms down by your side. But if you feel advanced, and maybe we get like 20 seconds through this, and you're like, oh, this is actually pretty easy, your arms are going to go out here to create a longer lever so your back muscles have to work a little bit harder. So we're using gravity and positions and levers to change the amount of stress that's in our low back without having to change the position of our spine. And so we want to make sure that we're not rounded for this. So we go tall kneeling, we hinge back, we go out here, and we're going to hold for 45 seconds. And maybe you're out here and you start to get tired, but then you can move here. There's no reason to stop. We just lower the lever a little bit or decrease the lever. Breathing, nice and long spine. No, we're not flexing our low back right now. We have a nice neutral lordosis there. Breathing nicely. Got about 20 seconds left. Maybe you need to change your position at this point. That's cool, no worries. We're just holding, we're working on the endurance of those muscles of our low back, the ability to hold positions for a long period of time, which is something that we need to do because we're sitting for long periods of time, we're standing for long periods of time. We need these muscles, good, to have great endurance so we can hold these postures for a little bit longer. We're going to do the same thing, but for the anterior portion of our body as well. So we're going to hold it isometric. We're going to need to be able to breathe so it's the muscles firing, not our lungs just filling up with air, providing rigidity to our trunk. We're going to do something called a hollow body. Now I have written down on my board back there that we're going to do 2, but like everything, maybe we'll have some flexibility. Maybe we'll do just one of these. We'll see how I feel after doing one. But it's going to really work on our obliques. It's going to work on your abdominal muscles. It's going to work on the deep spinal stabilizers. And we're going to be in a, say, maybe slight flexion of your lumbar spine. So if you know that flexing your spine and using your abs bothers you, this is going to be one you want to sit out. It's called a hollow body. And to do it, we're going to start on our back. Your legs are going to be up, kind of like you're doing those dying bugs or dead bugs. Your legs are up here to start. Your hands are going to, your palms are going to face up towards the ceiling. You're going to lift your head and shoulders just a little bit, okay? We're not looking for that full sit-up. That is not what we're going for. Just your head and shoulders off of the ground. Then you're going to extend your legs out, and this is it. This is your isometric hold. We're going 30 seconds. If having your legs up here is too hard, shorten them up a bit. If this is too easy and you can do it all day, bring your arms out here. It'll make it a little bit harder. I'm going here because I am shaking like a leaf. But I'm breathing, I'm making my muscles work. I've got 10 more seconds left. Then we're going to rest, and we're going to do it again. Just breathing, looking straight ahead. Okay. So we're going to get about 30 seconds of rest, and then we're going to do that one again. Like I was talking, so I had to be breathing, but you really want to make sure that you're exchanging air in and out. You're not holding your breath with this. If you have to hold your breath, I need you to shorten your lever a little bit, make it a little bit easier. Once again, if it's uncomfortable on your spine, sit this one out. Maybe we need to work up to this one, doing more of the McGill crunches and bird dogs and things that we've done previously on our low back days. It's time to go. So we've got our legs up 90-90, palms up. Head and shoulders are up, legs are out. We're going 30 seconds. Oh man. Trying to really pull my hands away from pull my shoulders away from my ears so I can use my lats to create a little bit more stability in my trunk. It's a great habit to get into because when we deadlift, we're gonna want to use our lats to create stability in our back. Got about 10 seconds left, a little less. Feeling the bird. 3, 2, 1. Okay. All right. So we're moving on to our hamstrings. Kind of going through all the bits and pieces today of what influences the low back. We're going to be stretching out our hamstrings in a half kneeling position. So one knee down, one foot is going to be in front, kind of like we do a hip flexor stretch, but for our hamstring. Now, you might realize I don't stretch the hamstrings a ton because I don't think that most people actually need hamstring stretching. I do think that some people do, but what I really think is people need to better be able to control their pelvis in an anterior, posterior pelvic tilt. Those things that we were doing earlier with the cats and the camels where we're controlling our spine. Now I'm going to have you test something out here that kind of proves my point. But a lot of people come in, they say, I ask them, hey, can you go down and touch your toes? And they say, no, I've never been able to touch my toes. My hamstrings are always tight. And I say, well, your hamstrings might not be tight. You might just be keeping them in a tense position that doesn't allow you to go down and touch your toes. Now, there's no perfect standard that says you need to be able to touch your toes because maybe you have short arms and long legs and you'll never get there. But what I want to see is how does your spine move when you bend forward? Is it a nice even arc or is it like a flat low back and then your upper spine bends? And that's a problem. It usually tells me that there is something going on with your hamstrings, but stretching isn't going to take care of it. But sometimes stretching can just make our backs feel a little bit better. And so what you're going to do is you're going to be down on one knee. You're going to have one leg out in front just on your heel. And if you need something to hold on to for your balance, great. It's not a balance exercise, just a stretching exercise. If you want your toes down, back, tucked under like mine are, you'll probably have a little bit better balance for that. From here, I'm going to push my butt back a little bit. I'm going to hip hinge like I'm setting up for a deadlift, or like a golf posture, and I'm going to feel a big pull on my hamstring. I'm already there, just for 60 seconds. Now this position that I was telling you that puts a little bit more tension into your hamstrings is an anterior pelvic tilt. So if I'm here and I'm getting my little stretch with a neutral spine, and I try to arch my back more, I feel like my hamstring is going to rip off of my body. And so you keep stretching, but what happens is if you're standing and you're doing that anterior pelvic tilt, and you're trying to go down and touch your toes, you're already going to have a ton of tension in your hamstrings, and you're never going to get down there. So we need to be able to control your pelvis a lot better, get you into a more natural or normal stance with your pelvis, and then you'll have a better shot at getting down there if that's something that you really need to do. I think we got about 10 more seconds left. We're going to switch sides. We're going to bridge. We're going to use our hamstrings, tell them to turn on, turn off, all that stuff. And then we're going to do something that we think we did last week, maybe a couple weeks ago. We're going to do some straight leg raises that really get our core firing, really get our hamstrings and calves stretched out. Once again, you're setting up one foot in front, toes tucked in back, pushing my butt back, getting a nice hamstring stretch. You can hold on to something, not a big deal. And we're just stretching out these hamstrings, and we're going to use them, and then we're going to actively stretch them. Maybe I could have flipped this order a little bit and be more effective, but we'll still get a lot of benefit from these three things for our hammies and our core. We've got 30 seconds left. I, for one, do not stretch my hamstrings very often. I can normally put all my fingers down on the ground. Sometimes I can get my palms down. That's good, it's cool, nice little party trick. But what I care about is, can I deadlift really heavy, showing that I have strong hamstrings, that I'm not feeling my hamstrings bite all the time, so that my butt is working. That allows my hamstrings to turn on when they need to and turn off when they need to as well. Okay. So, we're going to do a walkout bridge. So we're going to go up into that two-leg bridge position that we were doing before. But instead of kicking one leg out and the other leg out, we're just going to gently walk our feet out and then walk them back in and then reset. Go down and back up and walk in, walk out. We're going to do this 5 times. The further out you go with your feet, the more work your hamstrings have to do. That's a good thing. It means you're going to get stronger with that. But do what you can do. And once again, this is a bridge that's intended to make your hamstrings work, so there is a chance that you're going to get a slight hamstring cramp, maybe a big hamstring cramp. At that point, just take it easy. The next one is going to stretch your hamstrings a little bit. We're going to use our trunk. Just wait for us to all finish, and we'll meet back up with you. But for now, you bridge up, and you walk your heels out, 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 and then back in. Always trying to have control on your pelvis, and then you go down. And you're up, squeezing my butt to help maintain some stability and some rigidity through my trunk. And then I'm back in. And if your low back hurts when you go really far out, don't go that far out. Clearly, you can't, you gotta reset. Clearly, you're not producing enough force in your hips to prevent your low back from going into excessive extension. And we need to work up to it. So this is 4. So I'm able to get out here, that's a good thing. And we got our last one, just 5. Just 5 for today, waking up those handies. Tell them when to turn on and when to turn off. Okay. And now we're going to use our quads, our hip flexors, our trunk musculature in the front while we stretch out our hamstrings and our calves, things that are going to help us maintain a better trunk position when we go about our day. Okay, so this is going to be the very last exercise. We have been flying today. We got through everything in about 33 minutes. We're going to do 8 reps on each side. 5 reps on each side. What you're going to do, you're out here, arms are out to the side. You're going to lift one leg as high as you can with a relatively straight knee. Bring the other leg up. Bring that leg down. Then the first leg down. So it's a 1, 2, 2, 1 pattern. We've got 3 more to go on this side, then we switch. 1. My abs are working, my trunk is working, I'm keeping my ribs down. I feel my hips working. 3. Now I'm switching. And if you can only get up here with a straight knee, that's awesome. That's what you do. This one's individualized for you. If this is all you can do, then that's all you get. Don't force yourself into where you're bending your knees and all that stuff. Just work with your straight hamstring, your straight knees, so you can stretch out your hamstrings and your calves. You're not going to get there if you keep your knees bent. And we got 1 more to go. Okay.